Hi, my name is Tarun, and welcome to the first episode ever of Dad Talks. Similar to TED Talks, but it's all about dad. I'm a 7-month-old dad, and with me is someone who is an expert in the field, not being a father, but being someone who take care of people like us. A pediatrician, a consultant, a neonatologist, Dr. Prashanth Bhat. Welcome, and thank you so much for taking your time out.
Thank you so much for having me here. Really honored and privileged to be here.
Dude, it's been such a wonderful journey with you because I know as a father, I have called you, come to you, to your clinic at King's College Hospital, London. When it comes to Alana, my daughter, I have so many questions, and I'm pretty sure that people who are watching us are also kind of, especially who are new parents or
That's true.
wanting to get onto the journey or know someone who's a parent.
Exactly. Yeah.
Now, me being a 7-month-old dad, first question would be when we came to you with Alana for the first time, she had eczema on skin. Now, is that something which is normal, kids of that age, being you're a neonatologist? Could you please explain the meaning of that as well?
Eczema. So it's interesting one. It's a very common condition. Infantile eczema. We call it infant is anybody in the less than 1 year of age. Eczema is an inflammatory condition basically, and babies are not born with it; they develop. Some babies are more prone to get that than the others. For example, if there's a family history, for example, if you or your wife had some kind of allergies or eczema, it's more likely that your babies can get it. It's not as severe to begin with, but gradually it's controllable. So there are many rashes. So people often misled about what they're seeing. So this may not be eczema; just could be a normal baby rash to begin
Okay.
with. So there's a specific rash in newborn called erythema toxicum neonatorum. It's a
Sounds like a
complex.
spell from
I
Harry
know, I know.
Potter.
It just sounds scary, but it's a very simple baby rash.
Okay.
So I often say to parents, I don't even use the word because I don't want to scare them away.
Yeah.
I tell them it's a normal baby rash, so it'll fade away. So it appears a few days after birth and it disappears after a few days, completely benign. Now we do not know why that happens, but it's just so benign. We just reassure them, and that's the best part of my job is reassuring. Look, it will get better.
That's always good to hear, especially when it comes to being a parent. Now, when it comes to your being a neonatologist, what does that exactly mean?
Amazing. So you're not the first person who asked this. My father struggles to say what exactly it is. So neonate is any baby up to 1 month of age. So
Okay.
I look after babies until 1 month of age, of course, even beyond that, but primarily until 1 year, 1 month of age. So we train as pediatricians and then train as neonatologists. So any premature baby, any baby who needs surgery, any baby who needs cardiac problems, who needs attention, so we look after them. So our smallest baby is anywhere from 500 grams until 3,500 grams.
Wow. So
So
that is like from 500 grams, this is half a kg, 3.5 kg.
that's right.
And even in the early stages, that is first 30 days of their life of being born,
That's
they
right.
might need surgeries.
Absolutely. So they might need cardiac surgeries. We don't do cardiac surgeries in the center I work, but we do abdominal surgeries. So yeah, it's a long process. In fact, today there's I can't take the name obviously for certain reasons, but we have a very small baby going home today. He was born at 500 grams. He's around 2.5 kilograms. So very happy, healthy.
500 grams, baby. When was the child born?
He was born at 23 weeks. If we consider a full-term pregnancy as 40 weeks, so this baby is born at 23 weeks.
That's like just crossing the halfway line.
That is correct, yes.
And for 17 weeks, it was in the NICU.
And I see you with us, yeah, they've become a part of the family. See, it's amazing. It's a long journey for them. They get some withdrawal symptoms when they go home. They said, it's time to go home. So will you be with us? So yeah, of course, yeah.
No, but it's incredible amount of courage, hard work, dedication, commitment, empathy, love that must come from your end to make sure that the family
Yeah,
whose, heart is out there for
yeah,
17 weeks in NICU is being
yeah.
taken care of. So
It
well
is
done to you on
true. Oh,
that.
thank you. No, it's not just my one person effort. The way it works in an ICU, it's a team effort. It's not one person can't take any credit. It's a combination of incredibly hardworking nurses, the doctors, junior doctors, together, and along with that, other physicians, surgeons, physiotherapists, speech and language therapists. It's just a team.
Wow.
It just takes. So it's a proud moment for all of us when a baby goes home safe and sound.
That is always incredible for parents also to hear. Okay, let's now come back to our journey and my journey of being a parent, a father. Now, we come from Desi community and
Yeah,
there are so many things that we are told to do.
that's right.
जैसे ही बच्चा पैदा होता है, they are asking you, कि यार माखी चटा दो, घी खिला दो, दही यहाँ पे रख दो? Should we do that?
Strictly speaking, if you ask me as a pediatrician, no, because the recommendations are that we shouldn't give anything to a baby other than milk, because obviously the immunity is less. You're exposing into to different kinds of foods, so there's a chance of infection. But the other thing is they do not need anything other than milk in the first 6 months of life. So I know I keep getting asked this a lot. Because even with my own child, when my child was born, so there was a bit of a struggle with my mother-in-law. She's lovely, but it's one of those things where they want to do, and they say, "Look, we've
Because
been
it's
doing this."
rituals, right? It comes with a
Absolutely,
lineage of our traditions and everything.
absolutely. They say we've been doing this for ages, and we've been fine. So what's the harm?
Yeah, it's like we gave it to you. You look at you. You're fine.
Exactly. But I think from a scientific perspective, the way we work is that is there any evidence to say that actually works? Okay. So the answer is no. Then we say no.
Okay.
It's often difficult. We try and tell parents that what we're doing is not wrong, but that's not the normal recommendations.
Talking about breastfeeding, we just spoke about that. For first 6 months, child can survive happily on milk, and that's all the
Absolutely. Even
child
beyond
needs.
that, yes. Yeah.
Now, during the first 6 months, there are chances that the mother might fall sick, might get cold, cough, fever. As parents, grandparents, they tell us when you're sick, don't breastfeed the child. Is that correct?
That is absolutely not correct. So you can feed, baby mothers can feed irrespective of how they feel. Of course, if they have a breast infection, mastitis, and there's some blood in the when they're feeding, so that's when it becomes a bit tricky. All we say even then is to just give it a rest for a few days and then start feeding. So if a mother has a cold, she's feeling under the weather, feeling a bit tired, no, she's absolutely okay to feed.
Okay, and now coming to today's time in 2025, there are a lot of amazing formulas out there.
Yeah.
Now, when it comes to breastfeeding versus formula feeding, if a mother is not able to lactate, if a mother is a busy woman, especially in a place like Dubai where you get only 40 days, 45 days of,
Yeah.
leave or maternity leave, including 1 month before delivery, then how do the mother, carry on feeding herself? Is formula milk good enough?
Well, ideally speaking, we would like mothers to breastfeed. So breastfeed is the best feed of the baby because that's how the nature has been over the years, right? Think of a Stone Age.
Yeah.
When there was no formulas there, they had to breastfeed, and babies survived. They grew out to be healthy. Breastfeed, there are a lot of good factors about breastfeeding, immunity, sterile, and all those things. So there are lots and lots of, we can talk about breastfeeding advantages the whole day. So to begin with, I would like to say that's the best form of feeding. And most babies are enough for that. For example, they would feed and feed, they grow. And that's what I do in the clinic when they come and see us. We would just say, how's the feeding going? What's the weight doing? Are they having regular nappies, wet nappies, dirty nappies? Then said, don't change anything, just keep doing what you're doing. But of course, as you said, that's not always possible. And that's a priority from day one. So we say that in the first few days of life, mothers are unable to breastfeed for a number of reasons. Okay, some mothers don't produce milk for the first few days of life. All they produce is colostrum, and that's enough for some babies. But having said that, some bigger babies would need more, and they may drop the sugars. And that's something we don't like in babies because low sugars not good for the brain. So we say as a temporary measure, a supplement to breastfeeding, and not this is not a substitute, just a supplement to breastfeeding.
What is supplement breastfeeding?
So your predominant way of feeding is still breastfeeding.
Yeah.
You're just topping up with formula.
Okay.
So as the milk starts coming in, mum knows,
Okay.
a mother knows, okay, I'm getting milk now. Then you back off on that formula.
Okay.
We only do that for certain circumstances. For example, some babies are born smaller and growth restricted. We call that intrauterine growth restriction.
Okay.
These babies are higher risk of dropping their sugars if you don't give them milk.
Okay.
So if you just rely on them, they won't gain weight, they will drop the sugars. So we make sure, so that is the role of a neonatologist, making sure they understand what are the risk factors are, what babies are at risk, and then we try and intervene early.
Okay. So let's do one thing now. Let's talk about breastfeeding versus formula milk. 3 positive points for breastfeeding, 3 positive points for formula milk. What would those be?
The breastfeeding is the best feeding because it's sterile, as in there's infection free, lots and lots of protective factors for the baby, and less risk of diarrhea and all that. Formula feeds, I mean, positive points are it's calorie wise is similar to breast milk. I mean, it's not bad, but it's not like breast milk. It's not like breast milk, but the content are very similar to it.
Okay.
So if a mother should not feel bad, because I see a lot of mothers for some reason not able to breastfeed, are in tears, thinking, I'm not able to breastfeed, I'm not doing the right thing for the baby. I reassure them and tell them it's fine. Don't worry about it. Babies have survived. Babies will survive. There'll be no problem with it. If you're able to breastfeed, it's good. But if not, for some reasons, don't blame yourself.
Okay.
And that's the main message I want to get to mothers.
Okay. Now, when it comes to formula milk, there are many kinds of formula milk. I wouldn't not want you to suggest any brands if you don't want to.
No.
But let's talk about formula milk made of cow milk,
It
formula
can
milk
be.
made of goat milk.
That's right.
Uh, which one?
So all are similar in
Okay.
terms of the nutrition content, because they have to adhere to the exact composition. So you have macronutrients and micronutrients. If you look at the calorie content, it's very similar to between the breast milk and the formula. 63 calories approximately per 100 ml. Now, what the manufacturers do is to add extra bits to it: prebiotics, probiotics, and then you have different kinds of milk. You have standard milks, which is cow's milk based, okay, and then you have standard milks, which is goat milk based. Now, goat milks apparently it's closer to breast milk in terms of the protein content.
Okay.
And apparently it's claimed to be a bit more gentle on the tummy, so babies will have less colic, less constipation. Some babies and some people are allergic to cow's milk protein, the component within the cow's milk, and they can have lots of colic, constipation, rashes, and all that. So and then you have another special formula milks. For example, those babies who are not growing, you have high energy, high calorie formulas. And then you have broken down versions called hypoallergenic formula. So there are a
Wow,
number
okay.
of
Number of
formulas,
brands and
yeah.
products out there.
And within the standard formulas, cow's milk formulas, you have thousands of it. Even for us, when somebody comes and asks, "Oh, can we have this? Can we have that?" Over the years, we've realized is that people are turning organic, so they want organic milks. So the organic milks are available, goat's milk. So it's all about a choice of preference. So I say to parents, look, if you have started something, just because somebody told you to change, don't change it. If it works for your baby,
It works for your baby, yeah.
baby. It's very simple. There are a couple of standard brands. You pick up one. If they like it, forget it. Just carry on with it. But some babies don't like it. They don't refuse the milk, or they are a bit gassy. I said, try the other formula. So it's not a magic combination. It's all about not what works for one baby doesn't always work for the other.
So it's all
it's
trial
about-
and error and learning every
Exactly.
single day.
Absolutely.
Now let's talk about a very important subject: sleepless nights for a 7 months old dad. Uh, Alana has cried a lot at 2 in the morning, 3:30 in the morning, 4:30 in the morning again.
Yeah.
Now, the reason that we come to a conclusion to was she has colic, the word that not many parents like. How to deal with that?
It's interesting. Colic, by definition, is something that starts around 2 weeks of age. It peaks around 6 to 8 weeks. And by 3 to 4 months, it's gone. It's vast majority. That's how colic works. We do not know what causes colic, but it could be a number of things. For example, just as simple as trapped wind. It could be food allergies, so and so forth. It's very rare for babies around that age to have, around 7 months, like Alana has, to have a colic, but it's not unheard of.
Okay.
Obviously, they display a certain behavior. For example, colic tends to happen more towards the evening time and at night time. And if you look at the actual, you won't believe it if I say that the actual definition of colic is scary. It says crying for 3 hours in a day for at least 3 times a week for 3 weeks. I said, why would you wait till then? So,
Okay,
but what we
so
find,
fortunately that hasn't happened with me, but that is scary. Oh,
it is
just
scary.
imagining it is like
So I don't even
out.
mention that to parents. I said every baby is different.
Yeah.
So the symptoms can be as mild as squirmy, being really squirmy, uncomfortable, passing a lot of wind. And parents often worry, so, oh, doctor, he's passing a lot of wind. I said, don't worry about that. That's his way of good. Yeah. That's his way of getting rid of the discomfort. So you should be happy.
Yeah.
So, so yeah. Again, at that age, there are a number of things that can go wrong. One, they are now on solids. So Alana must be on solids.
Yes.
So what you give also makes a big difference.
Yeah.
So they could be constipated because they've been on milk for a long time, and then you're introducing some food, the consistency of the poo changes, the water content goes down, some babies can have constipation, they can have baby discomfort. So it's very difficult to pinpoint and say whether it's just the colic or constipation or something else that goes on.
But if there is colic, then again, going to our Desi community and old school ways of dealing with it, there is gripe water and there's something called gutti. We call it chatan. They put like a mixed powder. You put it in your finger and you make sure that the baby licks it. I've never done that.
Yeah.
Has happened to me when I was a child because I spoke to my mom about it. Do you think it's recommended?
Absolutely not. It's interesting. I mean, the kind of things I get asked for colic,
Yeah.
and sometimes I wonder, oh my God, I should probably go back to med school again
ये
to
तो
learn all
पढ़ाया नहीं इन
these
लोगों ने.
out of syllabus. No, actually, if I just break down this a bit more, because I think it's really important. Colic is a common problem in babies. It's most of the time, rather than prescribing anything, I usually spend time educating them because it's important to understand what causes it. So medications are usually, we don't recommend medications as usual. So what we say to parents is, this is what we do, is that we say that, look, try and manage colic with non-medication approach. It could be like simple colic massages. It could be some bicycling movements. All these, what they achieve is farting.
Yeah.
But once the discomfort, and you will see that some babies fart and they say, "Oh my God, this is
Yeah,
amazing."
relaxed, yeah.
But relax. So that's what we like to see, and I tell them clearly. For us, as I said to you, I keep saying this again and again. For us, evidence matters. So if there's scientific evidence to back any treatments, we would prescribe that.
Okay.
And having said that, you do not want to see a child's mother or father being upset, having sleepless nights, worried that the child is not getting anything. Just so we say to them, look, this is how you'd like to manage. What is colic? It peaks around 2 weeks. Peaks around 2 months, 6 to 8 weeks. It goes off spontaneously by 3 to 4 months. You don't have to worry. Sit it out. Just do some massages. Do other things like a soothing bath before bed, bicycling movements. So all these things can do. And if you still think your baby's got severe symptoms and you want to do something, yeah, of course, gripe water is something. So gripe water is basically ajwain.
Yeah, अजवाइन का
right?
पानी ना
That
यार
is
और
correct.
अजवाइन के तेल से मसाज जो
That is
करते
correct.
हैं.
That is correct. And some people also do hing rolls
Yeah,
on the
hing
tummy.
rolls,
I
yes.
do not know how this works, and honestly, it's a myth for me trying to understand and decode how this actually works. But I tell them, look, it's harmless. It's not going to get absorbed,
It's
so
a
it's okay.
placebo.
Placebo, exactly. It makes you feel better. Please do it. It's better than giving other. So other medications. So there is some evidence to say, there's a very limited evidence, I would say, very limited evidence to say probiotics work. They are good gut bacteria. That's something we prescribe. Well, we tell them, look, this is, if it's not needed, stop it.
Okay.
You don't need to, and you just have to sit it out. So that reassurance often helps. Some parents come back and they say, "Oh, I know you prescribed last time. We didn't have to use it," and that makes me happy
Yeah.
because I've achieved something I've always wanted to. Avoid giving medications.
Brilliant. Okay, talking about prescribing things.
Yep.
A lot of studies, people, Instagram reels again, of which we are a part of as well, says that vitamin D should not be given to infants and early aged children. Is that correct?
That's absolutely not right. So we start all our babies on vitamin D at the time of discharge, and we tell them to carry on giving vitamin D. Now, vitamin D is really important for bone growth.
Oh wow.
Okay, so they're growing bones. In fact, we need it. So if we get our vitamin D levels tested, you would realize that it's pathetically low. Mine certainly was. So it's about, for them, it's even worse. So it's important that we give them vitamin D as supplementation.
And for how long should it be given? For
Well, you carry on getting into childhood because,
okay.
obviously, exposure to sunlight is good. But in a place like Dubai, it's not that easy. When the summer starts, you're indoors most of the time.
Absolutely, in the AC, protecting them
Exactly.
from the heat.
Exactly. And this is why we say supplement that with vitamin D, and that really helps them for bone growth.
Okay.
So that's a myth to ask them not to give vitamin D.
Brilliant. Please do give vitamin D to your kids. It's extremely imperative and important for their growth. Now, if we can talk about the stages for the first year, again, being a 7-month-old dad, I need to genuinely know the timeline. So,
Yep.
I've now come to 7 months where now I heard for the first time yesterday of her lower teeth coming out
Yeah.
on a glass,
Yeah.
which again is not
Yeah.
something that I should do, but she just went for it. So I was like, fine, take. And I was like, hey, I was like, but let's start from month one. What to expect for a new parent till month 12?
And so you're talking about milestones.
Milestones,
That's
yes.
great. So milestones are, of course, I often say to parents that don't be obsessed about it. These milestones, see, babies don't read textbooks, do they? So everybody behaves slightly differently, the way they achieve milestones. This is just a principle. So
Okay.
at birth, your vision is not much. So your body is programmed to sleep for 16 to 17 hours a day. So there's nothing much they can do. So you have to be this close for them to actually see. So they go onto a cycle of eating, sleeping, and pooping. And once they slowly get a bit bigger, by 2 months of age, they are able to recognize the mother or
So
the
let's do
father.
one thing. Let's call first 1 to 2 months, eat, sleep, poop, repeat.
That's right.
Okay.
That's
Then two
right.
months is when
At
they
two
start?
months, when they start, the vision improves slowly. And when mom is breastfeeding or daddy is holding it, they'll give you a smile. That's a responsive smile. Okay, I mean, babies smile. Newborns also smile. They frown. I don't know whether you observed it. I love to do that. During my residency, that was in the middle of the night. If we got nothing to do, I would sit and admire those babies. They would frown. They would smile. It just make faces in sleep. So that's amazing. So those are different.
So 2 to 4 months
It's
is,
2 months is when they start actually responding to you with a smile.
and that's conscious
That
responding.
is correct because this is called social smile. Oh, I know you. Oh, that's mommy. Oh, that's daddy.
Oh, wow.
So
Okay.
that's amazing. So that's when the social smile comes, and then slowly start fixing and following. So they'll start tracking you. It's called tracking, the fixing and following it. So initially they said, "Oh, I'll follow you," till I can't be bothered. And then slowly they'll, "Oh, I like that." So they start moving around,
Okay.
and then they start making cooing sounds, completely non-specific sounds. And then by 3 months, the head starts holding. They start holding the head. Initially, it's a bit wobbly, and then slowly they hold it and start turning around. That's an advanced skill. So that's around 3 months. Once the head holding comes, then the next stage is rolling over. So from the tummy to the back to the tummy, that's between 6 months.
3 to 6 months. So that's a
5 months,
long,
yeah,
long
five
journey.
months, yeah. Again, I don't get worried if somebody comes and says, "Look, my child is not holding it at 3 months." I just give it a few days, and then you will be surprised in the next few days they'll start holding it.
Okay.
So unless they're very grossly delayed, we just don't jump to conclusions. We just look at the baby, examine the baby, listen to the story, and then make a conscious decision. Okay, do we need to get worried or not? Okay, and then once the rolling over happens, then they start sitting with the straight with you. Hold them and you start sitting. So it's called sitting with support. So the back is rounded, so they don't have a good back. So and at this point they start enjoying your tummy time. So tummy time is another question they keep. Sorry, I'm deviating slightly.
No, please.
But
Tummy time was my next question anyway.
so tummy time, if you look at it, again, there are a lot of myths going on. People say that you shouldn't do tummy time soon enough. If you look at the NHS website, this is not coming from me, it's a National Health Care website in the UK. You can do it from day one. But what they recommend is for small babies, they don't enjoy that tummy time that much. Do it on your chest first and do it for a short period of time. And once they get used to it, then gradually move out from the chest. And at that age, around 3 months of age, they'll start enjoying that because they have a good head control. One thing about babies is that you have to keep them engaged. They get bored really quickly. So throw some toys around, let them search for it.
Yeah.
And so that'll keep them motivated.
Yeah.
Again, tummy time is something they should never be done when they're drifting to sleep. They need to be awake and responsive so that they can interact with you and enjoy it.
Yeah.
They're really hungry, they're sleepy, they won't enjoy it. They become cranky, start crying.
And what should be the right amount of tummy time at what stage?
That varies from baby to baby. So as they get bigger, the amount of time they spend on the tummy becomes more.
Okay.
Again, it's to do with the motivation, right? So
Yeah.
they enjoy colors, music, sound. So you can keep them engaged. They can look at your face. A 3-month-old just managed to learn to hold his or her head. Would be like, "Oh, I'm just trying my head to keep my head straight." So so that it depends on the baby, and it varies from baby to baby. To be honest.
So let's conclude this by again just drafting out the milestones when it comes to age group 1 to
Yep.
3, 3 to 6, 6 to 9, and 9 to 12.
Sure.
So what can we expect in 1 to 3?
So 1 to 3 is more like eating, sleeping, pooping,
Repeating.
repeating, and social smile comes around that time. Fixing and tracking. At 3 months, you start getting around head control.
Okay.
Rolling over. That's 1 to 3.
1 2 3.
Yeah.
3 to 6.
3 to 6 is where you're rolling over from back to front, front to back. You're able to sit with
Support.
whole support, and then you start reaching stuff. Everything goes into the mouth. It's all exploration. It's a wow. This is a newfound. I'd love to hold on to eat it.
Yeah.
So yeah, and then the gradual skill is just to grab, cross the midline,
Yeah.
grab things, go into the midline.
Okay, now 6 to 9 months.
6 to 9 months. So that's where Alana falls into.
Yeah.
6 to 9 months, so they learn to go down. They enjoy tummy time more, and then they start the commando crawling. They'll be sitting without support. So the back, which is rounded, just straightens and becomes a bit really straight, and they're able to hold and sit. And then the next thing would be they start pivoting, they start moving around, and that's advanced skill if you think about it. The back needs to be straight, strong, and then to turn around. That's really amazing. So once that happens, then they'll be thinking about crawling. Okay,
And that would happen between 9 to 12 months.
yeah, yeah, around that. So after around that, yeah, it's 8 to 10 months.
8 to 10 to
Yeah.
11, depending on, as you said, baby to baby.
Every baby is different. So girls are quite good at milestones. The boys are a bit lazy. I hate to admit that, but that's what it is. So they start with commando crawling,
Yeah.
and that's the usually start. The dragging the legs, and slowly they go into the bear.
Is it okay?
crawling.
She's going in reverse.
That's fine.
That's fine,
That's
right?
skill. Of
She's like,
course.
and I'm like, no, it's forward.
They can go sideways too, but yeah, it's all normal. And then they start doing bear crawling. That's proper crawling, and then they start going really fast. And then they pull themselves to stand with support. By 1 year, they're able to stand without support. With support and without support, some babies are.
Wow, okay.
And by 13 to 15 months, they're walking without support and running, beginning to run. So
That is when the life changes.
that is correct, yes.
Okay.
So I often say to parents is, don't be obsessed about, if some domains of the milestones. So milestones we divide into motor milestones, fine motor, gross motor, social, speech. You will see some babies, boys are a bit behind in speech milestones, but that's okay. They catch up eventually.
Okay.
So most babies are normal.
Okay.
So we ask a lot of questions. And in fact, when they come into the clinic, we're talking to parents, observing them. They give a lot of information. They're looking around, sitting, walking. So I don't even have to ask the questions. Does he walk? Well, he's given me a live demonstration.
Yeah.
Don't
No,
have
but
to ask.
when we came with Alana to you
Yeah.
also, you look at her and you're like, she's fine. And I have like so many questions. And he's like, she's fine. I'm like, okay, thank you. Okay, let's conclude this with 3 most important tips that you would like to give out to new parents.
Well, I would say me being a parent, I'm not still a parent. It's enjoy your time with the kids. Don't be too worried about the feeding, eating pattern. If you're concerned about anything, consult a pediatrician. If you're not sure about it, I'd rather be asked 1,000 times silly questions than not be asked about something really serious. So yeah, that's it, really.
That's one tip.
Oh, one tip, okay.
Tip number 2.
Tip number 2, okay. What else? Don't worry too much about, because I get a lot of questions about teething, screen time in this age group. Okay,
That's a
I
very
knew
good
it, I knew
question.
it.
We'll stop right there. Screen time. Now, we made sure that Alana is not looking at TV. We made sure that we are not using our phones around her. What would you recommend to all the parents? Because that is one of the major most concern, how to reduce screen time.
So, oh my God, this is a big topic. Screen time. We live in a day and age where technology is taking over our lives, right? So, and I said to you before, and I say it again. My first and foremost tip would be a good role model. Okay, you rightly pointed out. If my son was 14 years, he asked me, "Well, you are using phone, why can't I use it?" So you just need to set a good example, okay? Making sure that you don't, family meal times, absolutely no screen time. Going to bed, no screen time, at least an hour before bed, so that you have enough time to detox before you go to sleep. Your sleep quality is better. And encourage outdoor activities. Come on, think about it. When we were young, there were no mobile phones, right? We used to go out and play cricket, badminton, football, swimming, or just stories, listening to stories. Dadi used to talk a lot about stories, those
Yeah.
things. Where are those days? So, encouraging outdoor activities, making sure that we pose limits. It's scary. You won't believe this. WHO, AAP, which is American Academy of Pediatrics, all have guidelines as to how much screen time is recommended. And if you see that, less than 2 years, they say no screen time whatsoever unless you're doing a video conferencing.
No screen time for
Less
less
than
than 2 years of age of kids unless you're on a video call with your nani or dadi. No screen time. That's quite amazing.
That is right. And this is based on a study. There was a study which looked at the quality of learning that a child less than 2 years can do when exposed to screen time, and compared to somebody who's interacting with kids and learning. And then what they've shown is the quality of learning is zero with screen time, because children at that age learn by interaction with others, with face to face. So the quality of that's really important, and this is why the recommendations from WHO, and there is a reason why. This is the reason why WHO and American Academy of Pediatrics all recommend no screen time, ideally less than 2 years of age.
I think that would really help a lot of parents out there. And yeah, let's get back to tip number 2.
Right. Teething. Now, teething is again, the reason I'm saying that is again, this is a common question I get asked all the time about, is my child teething? Is my child teething? When is my child teething? Is it actually come? I can't see any teeth. So babies can teeth anywhere around 6 months of age, but they can teeth earlier as well.
And
So
later
three
as well.
months later as well, until 12 months.
Okay.
So every child is different. So they display a certain behavior. Like for example, they drool a lot. They want to bite and gnaw on things. They can have a mild fever. Again, this is another myth. Teething will never produce a high temperature about 38 degrees. Usually mild temperatures.
And do they get constipation and lose motions around this
That
time?
is complete myth. So teething not associated with diarrhea. It's often associated by parents, but in reality, no. They can have drooling. They want to bite on things. They can have red gums. So as the teeth comes out, it does cause some discomfort to
Absolutely,
babies.
yeah.
But you can manage it with the non-medications. Simple things like just massaging the gums gently with your hand, clean finger, and making sure that you give them teething rings.
Yeah, the toys, the
The
teethers.
toys, yeah, the teethers, and make sure, and you put them in the fridge, not in the freezer. Not in the freezer.
Fridge, okay.
In the fridge, just to give them the soothing effect.
Yeah.
And people prescribe a lot of teething gels. Again, there's no evidence to say any of these work. So these are the things to
There are teething gels also. I had no idea about that. And thankfully so, because according to him, it's a myth. Finally, tip number 3.
Tip number 3. So, feeding. I do not want mothers who are unable to breastfeed to feel left out, and I want to reassure them that your baby is going to be okay, even if you want to formula feed. Even though we would say just breastfeeding is a breastfeeding. If you want to breastfeed, please go ahead and do it. Your baby doesn't need anything else. But for some reason you're unable to do it, please don't feel guilty, and formula feeds are okay.
There you go, ladies and mummies. Thank you so much, Dr.
Pleasure.
Prashanth, for taking your time out. Means the world that you came here. And wonderful having you here in the studios. And hopefully, whenever I have an issue, I'll come to you.
Sure. Thank you so
once
much.
again.
Thank you for having me.
Thank you. Thanks.